Thank you so much for inviting me to speak on behalf of breastcancer.org. It's an honor to be part of this important event with you, leaders in the Hispanic community and community allies who are working towards a better, more equitable, and inclusive future. I founded breastcancer.org as a nonprofit in year 2000 because I believe that people with breast cancer need more information and support than a doctor's visit can provide. Our mission is to help people make sense of the complex medical information about breast health and breast cancer so that they can make the best decisions to protect their precious lives. We want to ensure that people, regardless of their backgrounds or where they live or where they came from, have access to expert guidance on the enormous amount of breast cancer information, treatment, and research options that are available. We offer resources and an online community in both English and in Spanish. And if you or someone you know is in need of support, we welcome you to be part of our community. The reality is breast cancer impacts all of us. And for Hispanic women, we know that compared to the national statistics, Hispanic women have a lower incidence of breast cancer. That's 1 in 10 women versus 1 in 8 for other women. We also know, however, that among Hispanic women in the United States, breast cancer is the most common type of cancer and the leading cause of cancer deaths. Hispanic women are less likely to get an annual mammogram over the age of 40. They're less likely to seek medical help if something's wrong. And there could be a lot of reasons for this, but we know that we need to improve awareness and education to close that gap. For women who have recently immigrated, a language barrier, unfamiliarity with a healthcare system, or less access to doctors are all barriers to timely treatment. Hispanic women are also more likely to have breast cancer at younger ages, at later stages of disease, and also to have more aggressive types of breast cancer. And being diagnosed after cancer that has already progressed or advanced or spread could be linked to a delaying seeing a doctor when they know maybe something is terribly wrong. We need to remember that the Hispanic community, of course, is extremely diverse. There's no one size fits all. There's no monolith. And breast cancer inherently affects groups differently. For example, the country of origin alone is a unique characteristic that impacts cancer incidence as well as mortality. The bottom line is that as the largest minority group in this country and growing, it's important that Hispanic people remain vigilant about breast health and get the best access to the best forms of treatment. Now let's talk about risk reducing steps that all women, and especially Hispanic women, can take in their everyday life to promote their breast health and their well-being and to protect themselves against breast cancer. Probably the most important step for all people is weight reduction and just trying to get to and stick to a healthy weight. And I'm not talking about skinny, but the reality is that 1/3 of breast cancers in this country are due to being overweight. And the best strategy against it is a healthy diet. Sounds boring, but that's just the truth, that 80% of weight management is related to what we eat, and about 20% is exercise, also really important. Alcohol restriction is important because the more you drink, the higher the risk. We recommend that women know that 3 or fewer is best and less is more in this situation. Screening, getting your annual mammogram, going to see your doctor for a clinical exam, all really important and really help people find breast cancer early when it's most treatable with the least aggressive treatments and the lower likelihood that you would need mastectomy. Important also is breastfeeding. Breastfeeding helps reduce the incidence of breast cancer. It's better for the mom, better for the baby, and it actually helps reduce the incidence of the more aggressive types of breast cancer. And finally, just a word about genetic testing. It really helps us identify people who are at elevated risk because of maybe something they inherited, but it also guides treatment. And it's not something to be fearful of. It's like a light that guides your path that helps us take better care of you. So I just want to thank you all for the good work that you're doing. You're saving lives and protecting people and their families. We're so grateful to you. And thank you so much for having me and letting me be part of your movement. And I'd like to wish all of you a safe, happy, and healthy, and promising, and more hopeful new year.
Hi everyone, my name is Lily Gil-Valletta, the CEO of CM Plus and Culture Intel, and today I am delighted to be moderating this session for the Hispanic Leadership Summit 2020, focused on SDG 3. I couldn't think of a more critical and relevant SDG than good health and well-being in the season of COVID-19. And of course, because this is the Hispanic Summit, we're going to dive deeper into the impact of COVID in our communities and what are some of those barriers that are getting in the way of good health and good outcomes, and what can we do about it? And we have an amazing panel of experts that range all the way from the public to the private sector, and many other expertises that we will tap into right now. But you know what? Before we jump into some of the questions, I think it's important to set the tone, because it's the COVID-19 era, and we watch that ticker counter in a way when we're watching the news, and it has the death rates and the hospitalizations and what's happening, which is, it's a bit concerning, right? When we look at these big, bold numbers, but what does it mean to our communities? And let me share with you some of the findings and things that we've been studying in this era of COVID-19 as a cultural intelligence company. But first, let's start with the official numbers. This is pretty new if you look at it. Just a few weeks back, the CDC stated bold and clear that the largest percent increase that we are seeing for COVID-associated deaths, excess deaths, are actually contributed by Hispanic deaths. So let's think about that. Unfortunately, because we don't have all the data broken down by ethnicity, we don't know the actual count, but we know what that net difference is when you're comparing, and it's younger people. And I keep reminding people we cannot look into COVID solutions and interventions by assuming that one size fits all, because if we look at hospitalizations by age and ethnicity, and we only look at one bar chart, sure, we gotta protect the elders, we gotta protect long-term care facilities, and we need to put them first in line as we deploy the vaccine. But is that really the case? When for Hispanics, 51% of the hospitalizations are happening for people ages 18 to 49. We got to understand why. Why are our communities being impacted in such a younger cohort of the population? And that is exactly why we went into analyzing data to try to distill the why. Why are the mindsets shifting? Why are these emotional barriers or barriers to seeking care or not believing in the vaccine getting in the way of communities at large, but especially ours? So let me give you some things to think about. Number one, unfortunately, our optimism that makes us notoriously happy and cheerful about life and the American dream has eroded when we are now 1.9 times more negative towards just the ability to live life to its fullest with the financial wellness and the American dream that we are here for. But then when you also look at what is our perception towards, let's say, the vaccine, what you're looking at here is arguably one of the largest analyses of sentiment for the COVID-19 vaccine by ethnicity, gender, and generation. And look at us Hispanics, based on 253,000 data points. Almost 1 in 2 in our community are either negative or neutral towards the vaccine. We got to tackle these barriers, but what's underneath these barriers? In the case of Hispanics compared to other segments, we are concerned about the harmful consequences of this potential vaccine, the fact that it's unnatural. But here's one thing I want us to look at. We're worried about the financial implications. Who is taking the time to educate our communities and realizing that this is going to be public health, that you can be covered? We don't even have the vaccine yet, and our community is already worried about not being able to afford it. When you look at other segments here, well, there's a top 3 barrier to acceptance. For others, ranks last, like for the overall, for men, for women. So there's a lot of things for us to understand. I know this is a lot of information. It's an eyesore when you look at this chart. But my point is that without cultural intelligence into the way we deploy an inclusive approach to health equity, to vaccine confidence, to interventions for better outcomes. We may not have the results that we need. And guess what? We cannot afford not to have the right results. And that is why we have the panel of experts right now. And I'm going to pass it on to them so they can help us kind of break down these numbers, starting with understanding why is this disproportionate impact of COVID playing out the way it is for our communities? Why is it? And I'm going to start with you, Samit, as we look at the obvious consequences: higher hospitalization rates, 2 times more likely to die if you actually get COVID. Why is it, based on your experience, that we're seeing some of this now? And is it correlated to barriers in health that our community have even before COVID?
Thank you, Lily. And by the way, amazing data slides that you presented. And I think one of the most telling ones was the bar chart. And we keep hearing, if you listen to any news channel, if you read any newspaper, you keep hearing 250,000 American deaths. But I think the crux of the matter is you have to go beneath that to see what that really translates into. Because you just showed the age differentiation, the ethnic differentiation. So I think the problem at large is in front of us. And you're posing the right question, and your slides also showed some of the barriers. But to look at it from a slightly different perspective is going beyond that. It starts with the mistrust I think some of the underrepresented communities do have. And it's not out of nothing. I think it is based on some realities of the past, where experimentations were conducted without telling people, where informed consents were not properly carried out, where information was not shared properly, where there's a lack of education of what medicines mean, how access can be provided, how we can actually do more without necessarily having a financial impact on the societies. So I think that's just the starting point. The second part is healthcare provider differentiation and diversity in those healthcare providers. I've had multiple conversations with leaders in the Black community as well as some in the Hispanic community. And one of the common themes that I'm hearing about is patients really want to see and talk to people who understand them culturally, and also the body language and also the language, because they open up more freely and they share their thought process more freely. And today, honestly, there is that paucity of the diversity in the people or the healthcare provider community as well. Last but not the least, I think the socioeconomic strata and status also does play a role into it. So to me, these are just some of the barriers: education, diversity in the treating population, as in the healthcare providers, and the socioeconomic side of things. And of course, we need to work a lot harder to bring back the trust in the society and in the communities. That's the starting point.
Thank you, Samit. That is fantastic. And you know, that one chart I shared that shows that 51% of hospitalizations amongst Hispanics are ages 18 to 49. Unlike the common knowledge that the most vulnerable are our seniors, which I'm not discounting that, is that and younger Hispanics, but also essential workers. We're hearing so much chatter these days because of the vaccine distribution and deployment that we got to put essential workers first. But we often forget who really keeps America alive, AKA fed, which are our farm workers, right, Sylvia? This is what you do, and it's almost like these silent heroes that are out of the radar in a way, and they're still showing up every day at the wee hours of the morning. So can you tell us a little bit more about some of the challenges these communities face, and are some of these numbers in hospitalizations maybe tied to the fact that there are many of our community members that are exposing themselves, like the farm workers, day in and day out for us?
Right. Well, thank you, Lily. And when you were showing that bar graph, it wasn't surprising to me because many of our Latino community members are essential workers, and so they are exposed. They work in jobs where you can't zoom in, you can't work remotely. And so farm workers, they represent a very large number of workers across the United States, between 2 to 3 million farm workers across the United States, that really create that infrastructure for our food supply. And the majority of them, 80 to 90% are Latinos. And so when we're thinking about what are some of those challenges and barriers that this very unique population of Latinos is facing, and it's not just now during the pandemic, but historically, there are some inherent dangers in agriculture, some environmental and occupational risks. But then on top of that, when you look at, they primarily are in rural communities where access to care, access to healthcare services is very limited. And I think we've already heard some about the economic crises, some of the financial implications of having low wages. And then we talked a little bit, I think, already about some of the culture and then the language. So some of these all become challenges for not only accessing care, but engaging in the healthcare process. And what we've learned through the pandemic is all of these have been heightened. They've been highlighted. We've identified additional gaps. And some things that when there's a public health crisis, there are emergency situations. So I'll give you an example. Many farm workers live in congregate housing. And so as we think about some of the recommendations about social distancing, about quarantining, about isolation, if you are sick or you think you're sick, are very hard to do when you are in a place, in an environment in which you really don't have a lot of control. It really is up to an employer to provide that safety and those measures that will protect workers. And so it just becomes, there's additional barriers that we have identified and have had to deal with, especially with farm worker communities.
Thank you, Sylvia, for that. I feel like you're giving a voice to the voiceless that are keeping us going as a nation. So thank you for your work. And going from the very big role of farm workers to a very big and complicated place like New York, which has been quite a bit in the news, right? Like we locked down, we were diligent. I'm in New York City, right? You know, I talked to my friends in other places where my brother in Arizona, others in Texas, other places, and they tell me people are not as diligent wearing masks like we are here, New Yorkers, and other things. But besides the public health things we see on television with our governor's updates, I want to ask Lisa, straight from the source, what are some of those unique things you're seeing in your body of work that is impacting Hispanics in New York? As you have seen this pandemic unfold right before our eyes.
Yes, thank you, Lily. Well, here in New York, you know, as the governor himself says, we really went from worst to first. So if you remember during wave one, the city in particular really became the epitome and emblem of, you know, the ugly face of COVID and the devastating effects. And, you know, the governor and our team here has worked vigilantly, like day and night, literally 24/7, maneuvering as many specific operational strategies, everything from testing and contact tracing, you know, leveraging data, making decisions that are fact-filled, you know, literally exercising, maximizing every tool that we have in our government toolbox across the state to keep New York safe. And it is incredible. I think that if there's any state that has come close to cracking the code, we have. We are now at in December, before the holidays, we're seeing about 3.6% infection rate, which here in New York feels high, but was still relatively low comparatively across the country. Unfortunately, however, you know, the gaps that we're seeing across health disparities here in New York, nevertheless, are reflective and consistent of the gaps that we're seeing across the country. Not as deep of a gap. You know, New York is a state where there are lots of advocacy community groups that are vocal, as they rightly should be. But I think that, you know, like the secret recipe really is to have, you know, for one, the infrastructure and leadership, preferably of a governor, because really, you know, I think as a Latino household, Latinx individual, your zip code has never had a bigger impact on your life than right now. Like literally, where you live makes a huge difference. Who's your mayor? Who's your governor? What community groups are accessible? How do you have health care? Like really like all the social determinants of health, plus where you fit in not only in the landscape of government, but almost like a political landscape, right? Because we are seeing a divide between states where, I mean, you and I are both in New York. So if you walk down most streets in the city today in New York City, most people are wearing masks. If you're in a state in the Midwest, and you go to like a big box retailer, once you're inside, people be wearing masks, but not so much outside. So how can we begin to bridge those gaps? How can other states that are not adopting such stringent but effective protocols like New York, how can we as a community begin to strategically advocate on behalf of those protocols, because they do work, but do it from coast to coast?
Thank you so much. And I know definitely the world is looking into New York more than one way. And unfortunately, health equity or health inequalities that were already there before COVID are almost getting augmented. It's like they were put now under a magnifying glass. They're not new, they were there. And I'm gonna kind of ask Dr. Ruby to dig deeper into that, because clearly there's an issue on outcomes, underutilization of services. I know you work a ton in mental health. We've had the pleasure working together on mental health. Can you help those that are watching this maybe understand a little bit more of what is it that is driving some of this disproportionate impact or lack of, access to the services? I know you've done a ton in mental health too. So could you tell us a little bit more on that?
Thank you, Lily. Definitely the disparities in the healthcare are from the underlying medical conditions to the health insurance. So the Hispanic people have higher risk of chronic diseases and health problems like diabetes, high blood pressure, asthma, obesity, and all of these conditions are linked to more severe complication and death from COVID-19. This is one of the reasons why we can see this trend of more deaths in the Hispanic community. Also, the Hispanics may also find difficult to seek health care when they need. The Hispanics are 3 times as likely as white to have no insurance, which may lead to them to worry about the cost of care, for example. The language and the cultural barriers that already mentioned during the panel is something that add the challenge for Hispanics when they are communicating with the healthcare providers. Also, those factors cause the Hispanics to avoid seeing healthcare, and they are more sick, and you can see that the difficulties when you have the conditions that there is not a preventable, but when you have in addition to the economic pressure and health risks on Hispanic people, they have also they have to deal with financial stress, healthcare costs, job loss, etc. So I think there are too many issues. The Hispanic community, they have more risk to exposure to the virus because they are commuting to work in the public areas, close quarters. Also, the Hispanic people may have to continue working to support their families in addition to other things. We know that many Hispanic people have lost their job during the pandemic. So there is a lot of emotional stress of close living situation, and they are really impacting the Latino community.
Thank you so much, Rui. And just to put it again in perspective for some of you, if Hispanics happen to be more likely to be diabetic, it's anywhere between almost 2 to 3 times more likely. And a diabetic patient, when they get COVID, is 4 times more likely to die. You do the math, right? You start seeing how comorbidities or disproportionate impact of of chronic disease piles up in the middle of a pandemic when you happen to be one of those that cannot be working from home. And then you see those younger hospitalization rates. It's very interesting how you kind of see the public health story playing out. But I want to flip it around. Can we brighten up the day? Are there best practices? I am excited, Samit, to dig into this one, because I'm one of those kind of like pharma nerds that for the last 15 years has been looking at the fact that we have a lack of clinical trial diversity. Just to again put it in perspective, we diverse communities are 40% of the US population, but represent 2 to 16%, if we're lucky, of clinical trial participants. How can we know safety and efficacy of products, vaccines, medicines, if the future face of America is not represented in those trials? So when it comes to trials, how do we fix this? I'm just gonna throw it back to you. I know many companies are trying to get this right, and for the first time, I've heard the FDA commissioner be really bold on this one for the last month or so. So give us some light, some ideas. How do we fix this, Samit?
Well, we certainly are making some progress on that from our perspective. Let me start. I think you said it very correctly. I think it is about 18% of the US population that falls in the Latinx population by census, with less than 1% of them being participants in clinical trials. I think numbers are pretty similar for the Black population as well, less than 5% participation in clinical trials. And I think the reasons for the low participation is similar to what I spoke earlier about the mistrust, the lack of education, lack of information, lack of the diversity in the healthcare providers. So earlier this year, and it's always been in our DNA to look at diversity, I've been a big proponent of that right from the beginning. We did a few things and we made some commitments and we put ourselves to the task to really combat this as a beginning, as one of the parts of the overall ecosystem of healthcare. And we put our heads together and we've now committed basically about $300 million to be able to make a difference. We're actually working with academic institutions and societies and organizations to be able to train about 250 fellows from the underrepresented communities and diverse communities who will continue their progress in the fellowship programs, but come out with a mentality of progressing enrollment of diverse and underrepresented communities into clinical trials. We're also working with similar organizations to also train 250 medical students to put that in the curriculum to really bring that thought of diversity right from the beginning, so that by the time of 2025, at least 10% of these fellows who are being trained right now will come with a full-fledged training and infrastructure for conducting clinical trials that will enroll diverse communities. We've also committed to enroll at least 25% of the clinical trial sites in 10 urban areas, and these urban areas chosen for higher population where the underrepresented communities actually live, such as looking at Dallas, looking at Detroit, looking at LA, looking at New York, in fact, parts of New York and many others. So we are committed towards those 25% of the sites in our pivotal trials starting next year. Now, going beyond that, I think it's important that we also hear from the patient. And so the other commitment we implemented actually already earlier this year is to listen and engage with the patients, our advocacy groups, to get that patient voice in the development programs. And I'm very happy to report that we, I think, now have 10 or 15 protocols that have already gone through that review process. We already have the patient voice in the clinical trial process. So I'm really proud that we've taken the first steps. But as you said, this is just a drop in the ocean. We can't do it alone. It will have to be a community effort. It will have to be the whole ecosystem coming together. And then only we'll be able to really have an impact. This is not also a journey that we'll forget after maybe the vaccines become available. Maybe we'll forget about the pandemic. That's human brain. We do tend to forget the bad things very quickly. But this is something that we need to remember to continue to invest our time and our energy, because this is the long-term game that we'll have to play.
Thank you. That is fantastic. And those are such great ideas and interventions that you have in motion. And I am curious to hear what, we have learned and implemented in New York, Lisa. Like, you just went from I love how you put it. Like we were the ugly face of the pandemic, and it went from that to success. What are some of those things that, I guess, silver lining of having to manage through a crisis that became new solutions or interventions to fill some of these gaps in care?
Yes, thank you, Lily. I mean, I would say it takes a village, right? Like, I don't think we've seen anything like this crisis in a century that has made government play such a pivotal role upon the impact of daily life. And, you know, I know that this question was framed of what can we look to as positive construction solutions and best practices, but I do want to just hit a couple of quick statistics to reverberate your fantastic slides and data points at the beginning of this conversation. And one is that even though Latinos and Latinx community comprises 18.5% of the population, we comprise about a quarter of all COVID deaths. So 18.5% of the population for 24.2% of all COVID deaths. And what you said earlier about how our community is also more susceptible to chronic diseases like diabetes, 4 times more susceptible. Well, it's no coincidence that our hospitalization rate among Latinos is 4 times that of whites. So, you know, there is symmetry along those guidelines. From a government political perspective, what are those tried and true methods? I mean, I have to say there's nothing astounding, nothing glamorous about it, just a lot of hard work and grit. So I would say number 1, testing. You know, we went from literally, you know, ground zero to now conducting more than 200,000 tests a day in the state of New York, which is remarkable. Like if, you know, you turned back the clock and said that we could do that in April, it would have been sobering. Because remember, the start of the pandemic and why it so quickly grew is that if you don't know who's infected, right, the community spread just kept growing. So testing, and then contact tracing. So we here in New York, we have over 4,000 contact tracers. That's another key vehicle, because the faster that you trace someone who might have had, you know, close or proximate contact to an exposure, the faster you can like contain, right, the virus. So that is a key vehicle, and 4,000 is proportionally a higher number than what other states employ. So that is also key. And, you know, like we're also maximizing everything we can about data, about technology, so that as we, you know, we really like calibrate, you know, our strategies daily. I can reassure you that, but we're doing it because, you know, we're trying to beat this virus. And so, for instance, at the start of the academic year, you know, we set up a school dashboard. You know, we required schools to report, not just for students, for staff. We then initiated like a microcluster strategy to be really specific and have, you know, again, data fact-filled updates that would resonate with people. Like, where is my block? You know, like literally, like, am I on a safe block? Can I visit my loved ones? And then I would say, you know, in closing, just like all those tried and true protocols. So washing your hands, keeping socially distant, you know, as a community, Latinos, you know, we have different generations within one household. We love familia. We love like getting together, and the holidays are a key time, but, you know, it is an important time. Like we just had Thanksgiving elapse. If you really want to show your love and support for your family members, this might be that holiday that instead of visiting, you know, your tias and abuelos and your primos, like stay home, be safe. You know, tell them how much you love them, you know, by FaceTime or some, you know, by phone, by laptop. But getting back to what Sylvia was describing about our susceptibility as essential workers, as, you know, our community not really having a choice so much of being able to work remotely. This speaks to the farm worker population. This also speaks to, you know, the folks that keep meat and poultry processing and packing plants, you know, delivery workers, supermarket staff, like all the essential workers, you know, who have no choice. So again, advocacy, as Samit has spoken about, you know, or can you reach out to your local community organization? Where do you go for information? There's a lot of fear and mistrust. a lot of consequences and concerns about immigration implications, just even signing up for vaccines, right? So, I hope that other mayors or governors, elected officials, or even if you're an advocate in your community, or you have a close alliance with a community-based organization that is vocal, hold leaders accountable. So last thing I would say on that point is, just today, Governor Cuomo announced his commitment, our commitment in the state of New York, to bridge those gaps across health equities. And he has been vocal with leadership from the NAACP. And today we actually issued a letter that was signed in concert with 54 community groups here in the state of New York that have signed support to bridge those gaps. And we have also taken another stand in terms of the beginning of our framework for vaccines. The CDC under the current administration has asked for personally identifiable information, private information that could be potentially shared with other federal agencies. And here in New York, the governor has said no. He's taken a stand because we don't know if this administration would share that PII, information with ICE or another agency, right? And so how do we balance public health, but also keeping our community safe? So, however the best practices here employed in New York can help inspire or engage other elected officials, whether in office or whether at home, right? Because we all have a voice. We hope that New York has inspired and encouraged others across the country to do the same and to be a voice for Latinos.
Thank you, Lisa. And I could have a 3-hour conversation with all of you. I'm looking at the time and I'm like, oh, I wish we could stretch it more. I'm going to try to wrap the one question for both Ruby and Sylvia, because I want to hear from you and your body of work in mental health with the farm worker community. What are some of those best practices that maybe we can borrow, amplify, expand beyond the pandemic that will help us serve better our communities? Ruby, let's start with you for mental health.
Yes, Lily, this is a great opportunity to talk about mental health. This is with the not only for the Latino community, but in general. Mental health always has been in the back, of all the conditions. So now mental health is at the front, and we have more. We put mental health on the table. So what we try to do is to educate the community. What can you do in order to manage your stress, mental health issues caused by COVID-19, for example, and telling about practical steps. When we advise people what we are going to say them. So we know the social distance is adding stress and anxiety, but they are really a lot of communication ways to stay in touch with friends and family by phone, video, with the technology. But also we advise to take a break from watching, reading, or listening the news. There are too many news, and we advise to use trust information, trust sources. The Center for Disease Control, for example, they are also some we advise to try to maintain healthy diet, exercise, and sleep routine. Also to contribute with local food banks. With some neighbors have been creating their own food banks. So all of these community support, the community should be more involved in those. There are also to put on, not to put, just to be for the urgent emergency healthcare, not for chronic conditions. If you try to handle the best for telemedicine or call, avoid to go to the healthcare providers, hospitals, If you cannot work, for example, there are some unemployment insurance from the states that change state by state. But I think that we can connect the people with all of these resources. Also the prayer, meditation, other practice that can help during these difficult times. There are also the opportunity to share stories about resilience, survival from the past, from the family, from the culture. So all of these, they are things that we advise. And also one thing that we have is handy the hotlines of resources that we may have for the community. And they are in Spanish, the disaster distress helpline, the National Suicide Prevention Lifetime, the National, they are domestic violence hotline. They are in Spanish now. So the suicide prevention. So we try to communicate all of these resources to the Hispanic community so they can use those.
Thank you so much, Ruby. Who knew that it took a pandemic for all of us globally to recognize that mental health is at the center of us keeping it all together, myself included. Sylvia, how about from your farm worker efforts? Are there any best practices or things you've seen that emerged in this season that maybe are worth investing in and expanding on?
Absolutely. And I want to catch them, I think, for the Latino community as a whole. I mean, certainly the farm worker community benefits from these as well. And I want to hit on three major things that, first of all, and this is real, it's not new, it's not innovative, but I think it goes back to the resilience of our communities and the trust. And so really engaging our communities with members of their own community. So the Promotoras de Salud program, I think that is a real key. I think that we've seen it expand throughout the country. But it is a program that's isn't always fully financed. And so we see some communities that have expansion in those programs and then they lose funding. And so I think that they are critical in order for us to completely have that trust as well as provide that communication. I think our communities hear a lot of information and it's hard for them to decipher what's real, what's not real, what should they what is the guidance that they need to follow. And so Promotoras de Salud are really critical in regards to seeing them as part of that health team. And then secondly, you talked about silver linings. And I'd like to talk about one in that it is a way for us to increase access to healthcare services for farm workers, especially in remote areas, and that is telehealth, the use of telehealth. And so I think that as we look at how we can expand that, we also need to make sure that our communities can be fully engaged. We've always been looking at health literacy, but now we need to look at digital literacy, and our families need to be able to engage in that type of a service delivery model. And it's up to us to ensure that they not only have the proper equipment, but with that equipment that they know how to use it and know how to maneuver in a very digital society. And then lastly is, sometimes it becomes very frustrating because a lot of the information and education and guidance that we receive is in English and then it's translated into Spanish. And that's not the same as developing materials in Spanish for our Latino communities. So I like to really emphasize that we really need to look at, we have the resources, we have the capacity to be able to develop those materials in the language that is preferred by our communities. And I think it makes a world of difference. It is not the same to translate than to develop in the language of our communities.
I love it, Sylvia. Thank you so much. I've been taking notes here because I think for the last but very important rapid fire type question, I'm going to go off script for a second so that we can stay on time and leave with some action. I'm going to go to each and every one of you, but if there was one thing we could do, right? This is the context and the moment of the Hispanic Leadership Summit 2020. Everything that we are all human is advocating for unifying us. There may be all of those partners you wish you could connect with that are watching right now. What is the one thing you wish we can do or get done as a community? And let's be focused, because it is the Hispanic Summit, focus for the Hispanic Latinx community to achieve better health, to fill those gaps in care, to achieve and accelerate health equity. So I'm kind of extending my question so you can think about it. One thing, you have a magic wand. What is it that we can do together to get over all of these numbers, hospitalizations, bad outcomes? Let me start with you, Samit.
Sure.
Yes.
Well, I'm the lucky one every time, so thank you, Lily. I think it is not a nice to have, it's a must to have. And what I would say, combining what Sylvia said and what Lisa said, educate in the language that people understand, especially in the zip codes who don't speak English, give it to them in the language they understand, and update the data as it becomes available. Because negative propaganda, I don't know who it helps, but that's making more noise than the positivity of the vaccines or anything else.
Thank you. I'm going to go with how I see you in the tiles. Sylvia, you're next.
You know, I'd like to say that if we could really establish a patient-centered health home that extends beyond the healthcare facility, but into the community. And if we can think about it, then it reaches our Latino communities, as well as it begins with prevention. And so in establishing that patient-centered health home, we already begin by looking at how can we prevent versus having to always be responding in a critical moment.
Love it. That is the holy grail of healthcare. Graduate from reacting to prevention. How about you, Lisa? What is your kind of magic wand desire?
Thanks, Lily. I'm going to cheat a little bit. I'm going to do a magic wand for today and a magic wand for tomorrow, okay? So since it's December and we're about to have the holidays, mine is please stay home, please stay safe, do not socialize. If you really love your family, this is not the time to have, everybody at the mesa and have a big meal. It really is the time to stay safe. Magic wand for tomorrow, I think part of the challenge of breaking down these barriers is we need more Latino, Latina, Latinx nurses, doctors, healthcare workers. Let's invigorate, let's get philanthropy, private and public sector to work together to have new generations and really amplify, because if we have doctors, nurses, healthcare workers, voices that understand cultural competence, that people feel comfortable going to for help, that's going to make a world of difference and be a voice for clinical trials and everything else. So there you have it, Lily.
Awesome. I love that. Ruby, you are closing us with your wish.
Education. I think that this is the word. We need to educate people in the community, not only about the diseases, about mental health, but also educate with the idea to have more people in the healthcare profession, more doctors, more that they have, the possibility to treat their own community. So education in general, I think that we conduct one study with Lily where we realize that not only is the cultural part, but also is important to educate the people about the condition, the disease that has a solution, has a treatment. So I think the education is the key piece for me.
That is fantastic. So I'm going to close us with kind of like a call to action that comes from Spider-Man, the movie. It says, with great power comes great responsibility. I feel each and every one of us here has the power of knowledge. Maybe those watching had the power of learning something new about the disparities, but don't let the numbers discourage us. It should motivate us to take action. We are contributing to 50% of the population growth of this country. By the year 2040, we will be a majority minority nation. That is only 2 decades out. We either get this right now, or it will be mathematically impossible for us to get rising cost of healthcare under control if all of these underlying disparities in chronic disease, access, outcomes, all the way upstream from clinical trials to the way we launch medicines and vaccines. If it's not culturally intelligent, we may be missing out on the growth segments, which are highly likely to be Hispanic, to be served properly. So in your own words, we need that cultural intelligence in the materials and the language that we use, in the way we deliver care, maybe reimagining the patient-centered health home, or the places and spaces where we intercept people for wellness, in motivating careers in healthcare, all the way from pharmacy to tech aides to MDs and PhDs. And of course, all of that boils down to education, as Ruby said it. So let's go out, exercise our superpower as Spider-Man of cultural intelligence. And thank you so much for all the work you do. Thank you. We are all human. Claudia, for your leadership and for allowing us to have this very important conversation.
Thank you.
Thank you.
Thank you so much, Lily. Thank you.
Be well and stay home.